Pursuant to the Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, General Law, Chapter 30A, Paragraph 18, and the Governor's March, I'm sorry. Oh, okay. So I'll start over. The meeting's being recorded. If anybody is doing
No, you
their
don't.
own,
You don't have.
if anybody's doing anybody doing their own recording, you need to let us know now. Okay.
Who's that coming from?
Nothing here.
Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law and the Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation can be found on the Office of the Attorney General's webpage. No in-person attendance of members of the public will be permitted. Draft minutes will be posted on the town's website as soon as possible after the meeting. Pursuant to Mass General Law, Chapter 30, Paragraph 20, in an emergency, a public body shall post notice as soon as reasonably possible prior to the meeting. Notice shall be printed in a legible, easily understandable format and shall contain the date, time, and place of the meeting. A listing of the topics that the chair reasonably anticipates will be discussed at the meeting. So before we get to the minutes, I'd like to, for clarity, yesterday we were made aware of the fact of that the board, that Tammy wanted to discuss the.
Jerry, is that your, is there something wrong with your microphone? Like, is it?
I don't know. Can you hear me?
Is it pointed to another area? You're
Not
hard
that
to
I know
hear.
of. You can't hear me?
You're really low. That's all.
Okay, I'll try and turn it up. I'm not real computer good. Any better? Okay, I'll yell. Is that any better?
Yes.
Okay, so we were made aware of the fact yesterday after the agenda was posted that we needed to discuss the upcoming J-Day discussion at the motocross. And so we posted as soon as possible, which was today, less than 48 hours before the meeting, that we were going to do the discussion, which is in compliance, as far as I can tell, with the open meeting law. So if anybody had any questions, they can ask them now. Okay. So did everybody get a chance to read the minutes? Sue?
Yes.
Tammy? Jean?
Yep.
Okay, and Tammy, are you all set with them? Okay, Jessica, did you get any corrections that might have been made?
Yes, I did.
Okay, I'll take a motion to approve the minutes as corrected for the last meeting.
I'll make a motion to approve the minutes from the last meeting.
Okay, second, all in favor? Jean?
Sue, yes.
Okay, Jean,
Yes.
and Jerry, yes. Okay. So we'll move on to public comment. So I'll start. Peter, you have anything you'd like to ask us or make a public comment now?
No, but just letting you know, I'm gonna have to leave this meeting at 6:30 for another meeting that
Okay, so
I
we'll
also have
try
to
to get,
attend.
okay. Mr. Johnson, I guess we're gonna get to you. So we usually have public comment at this point, but if, we're gonna, unless you have anything to say for public comment, we're gonna just move down to your discussion in the next point. Is that okay?
I love it. Thank you.
Okay. Anyone else have any public comment at this time? Okay, I see Joe's running around. Okay, so now we're going to discuss the J-Day. Tammy, could you kind of explain to us what the J-Day is?
I don't think I could actually explain it, but the reason why I brought it up is that it was brought up to me that it operates a lot different. Not a lot different, but it's different than on the normal events that motocross has had at the WIC. And I guess in the past, it's a larger number than what we've been dealing with. And so before the event comes upon us, I thought it would be best to hear more about it and to kind of talk about it and discuss some of the strategies for keeping with, COVID compliance and everything like that.
Mr. Johnson, you want to explain to the board what the J-Day is?
Yeah, and let's first go back to where we are right now. And forgive me, I'm not used to reading from notes, but I don't want to miss anything because I know that none of you have really dealt with what we have done in the past. Tammy is aware of a lot of what I'm about to say. Doug knows it, Joe knows it, but I don't want to miss anything. I want to make sure that we're all clear what we have. So forgive me for reading, which I'm not used to doing. So over the past 19 weeks, we have successfully run 20 events with no incidents. In anticipation of risk escalation in the fall, we all know that the potential for it coming back. Each week, we have increased our social distancing presence and guidelines. I'll be honest with you, when we started doing it, it was very difficult to do all the things we wanted to because it's not in the culture of the people that come in. And each week it gets better and better, and we keep putting stronger and stronger restrictions on them. Initially, we operated under the basic rules of when not on the track and covered by your helmet and face shield, or when not within your immediate pit area. And for those of you who don't know it, we actually go out and we paint on the dirt every single week an area that socially distances each and every group that comes in, so they have to stay within their pit area. That is their designated area. So with that said, so as long as you are on the track or you are within that pit area, if you're not there, you must maintain a 6-foot separation from anybody else outside of your pit area or any of the workers on the track or in the facility. If that is not possible, you must wear your mask. Those are the rules, the basic rules that we've been living by since June 6th. We've amended that going forward. We feel that it's important that we change that a little bit. When not helmeted on the track, as usual, with the face mask, or inside of the immediate pit area, masks are mandatory at all times. We don't care. We don't care if you're 6 feet apart or not. You will wear a mask if you're not in those designated areas or participating on the track itself, where obviously distancing is actually a natural part of their makeup. They don't want to touch each other on the track. It hurts. So in the meantime, in a time when the ridership is at an all-time low, we have added staff to monitor the facility all day long. We've even hired parking staff to ensure proper distancing. Again, that is within the marked areas that we paint every single week before an event. Excuse me. I do have a cold. I haven't tested. I'm not positive. Of the 9 New England motocross facilities, we are the only track adhering to these standards. We are very proud to have taken that leadership role in the New England motocross arena. We do see that many of the tracks are now picking up on our lead and taking care of some of the things the way we have. The signage that we put out there is significant. We've spent an awful lot of money cordoning off the bleachers so that people cannot congregate there. So let's get down to the J-Day. J-Day is different in a few different ways. It does not operate just on the motocross track. We have an adjacent piece of land where they race half of the motocross track, and then half of the race is in the woods. So it's very separated. It's spread out even a larger area, whereas the motocross track, a normal lap time would be, let's say, 2 minutes and 20 seconds. On this, you're talking more like 7 or 8 minutes. So they're spread out a lot more than they normally are. So J-Day, where are they right now? This coming weekend will be their 8th event of the season. with no incidents, as we have had no incidents. The difference is they have had no headcount restrictions. They have allowed anybody and everybody to every single event that they have had other than at Southwick. We haven't had one at Southwick. We normally have two. However, that's not our intent. Other than their very first event of this year, which was up in Maine, their average ridership is off approximately 23%. That's very similar to what we're experiencing at our track right now, between 25 and 30% fewer riders than normal. And a lot of that has to do with the restrictions that we do make them go through that other tracks do not. And they know that, so some of them just don't show up. But because J-Day's entries are generally larger than most organizations, it's our plan to reduce the maximum pit crew from 3 to 2. Right now we have a rider and we have 3 pit crew. And I know that pit crew is an ambiguous term. A pit crew could be a wife and 2 kids, but they're significant within that group and they stay within their pit area as a group, a family, a team. That will bring the net number to approximately 6% below what we are currently allowed to have at an event. As with all of our 2020 events, there will be no general admission spectators allowed. That's significant, much more significant at J-Day than it is at any other event. And the reason for that is more than half of the J-Day crowd that we know traditionally that come are spectators. They're spectators that are not related to any of the riders. They're groupies that follow this group all the way around. And I should note the fact that they've had 8 events with larger crowds than what we're used to, including the groupies, and they've had no incidents, none. They're the same people that go every single week for the last 8 weeks over the period of time. Another key factor that is unlike other events, the contestants on track time actually are staggered. Whereas the normal motocross event that we run week to week, every single rider starts the event at 9 o'clock, roughly 9 o'clock in the morning. And we'll change that to daylight savings time. It'll be 8 o'clock in the morning. At the J-Day event, some of their riders don't even arrive until noontime, just about the time that the early riders are packing up and getting ready to leave. So you have this steady flow of people going in and out. And we've created a one-way in, one-way out. They don't pass each other. They're all completely separate. Excuse me. Because of the unrestricted J-Day spectator crowds of past, we certainly understand the board's concern, and we are with you. But we're also very well prepared to handle this safely. And I think the new rules that we've put, and we've escalated the rules to a point that'll handle this properly. It's not going to be taken well by the J-Day crowd. I've already discussed this with John Day, and there's no choice. You continue to do exactly the way we've been doing it for the other events. We're limiting the amount of pit crew, and we know that we're going to have spectators very upset that if they don't get the message, and we're hoping that social media will give them that message to keep them away, because they will not be allowed unless they're physically with the rider.
Oh, it's 1 rider and 2 people?
Yes. Yeah. Right now we have 1 and 3. 1 and 3. And that's worked out very well. And we've never really had to exercise the 3 on a full basis, because we needed the 3 because exactly what I said earlier. You have a rider, a spouse, and a kid or 2. Very seldom do you get that many within the group. The average is much lower than 4 riders per. It's the same thing here. J-Day is a different crowd. You get a lot of solos. The only larger amount of people that you get are the young kids that race first thing in the morning. And then they normally leave by noon or 1 o'clock.
So, Mr. Johnson, my question, what happens to someone who's walking around the track without a mask?
They'll be asked to leave. I don't have the jurisdiction or the ability to get every one of them, but we're bringing in a greater, right now we have 3 people that run around and monitor this. And this week is the first week we will have it mandatory without you have to have the mask. So it's going to be new to everybody. But that is going to be well represented in the sign-up information online that John Day will send out to everybody. And we will enforce it as best we can. I'm not going to call the police in every time, but I will photograph everybody that does not comply, and I will make that public knowledge.
I will point out that with the new amended sports standards, that the masking is required.
Yeah, I agree.
It's no longer 6 feet or a mask. It's 6 feet and a mask.
I agree 100%.
So
How many riders will there be?
Generally, you'll get about 700 signups, which would be roughly 350 riders, which is very similar to what we've, just a little bit more than what we've had on recent full race weekends. They normally sign up for 2 classes. There are very few that don't sign up for 2 classes. We haven't put it to a maximum amount of people, although we have put it to a maximum amount of people, but we've actually held it ourselves and restricted it to how many signups.
So that's 1,050 between the riders and their pit crew. If you have 1
Yep.
rider, 2 pit crew, you
Yep.
have 350. And then you have the mother and the 2 kids. And so
No,
No, they are the pit crew.
That's
The mother and the 2 kids are the pit crew.
Okay.
Either, well, it'll be different now because you can only have 1 kid. You can have,
Well, what
you can have,
if somebody shows up in their RV with the husband, wife, and 2 kids? You just what? Tell them.
well, they're not gonna be allowed in.
Okay.
It's very clear. And we did that in the early stages. When we were very limited to 50 back in June, we turned people around. And we had signage before they got to the track, alerting them to that fact.
Gene, I'm sorry I interrupted you. You want to keep on your point?
Well, part of my point here too was, it's my understanding you also applied for a liquor license.
Not me.
So there's not going to be any liquor sold in the area
Never.
or at the,
The only liquor license that I ever applied for is for the National. I've never applied. I don't know who did, but not anybody associated to J-Day.
Doug?
okay.
Doug, you heard?
I wonder where that came from.
It was just something I heard in town hall today.
No, not by me. And
Joe?
I'm the only one who can apply for a liquor license on that property because I have the lease.
Okay.
What type of permits do you have to apply for with the select board, right?
Yeah, and we have. This has been on the select board permit since early year.
Hold on for a second. Doug or Joe, do you know anything about this liquor license?
Joe, you're muted.
Joe, I think you're muted. Joe, are you muted?
What's that?
Okay.
Hello,
Hi, Joe.
There you go.
is there an echo?
no,
Oh,
what
you're good.
type of permit? What type of permit is issued for the motocross by the select board?
We permit him every year for the events he does.
What's it called? Like what's it called?
His calendar,
What kind of permit is it?
It's under a license agreement that
Oh,
that the Moto and the Legion have with the town because of the license is granted because that they're leasing town property as part of the overall event area.
So we still haven't got an answer. Joe, you know anything about a liquor license for this event?
I don't.
so if there was a liquor license, it would have came in front of the select board. It has not.
Okay.
There
so
never
no
has
liquor-
been one for J-Day.
Gene, you
Okay. I
I
must
would
have
not allow. I would not
apologized.
allow-
I must have misunderstood.
Yeah, Gene, I would not allow a liquor license for any of our events because we have no spectators at these events. And we're not about to let anybody ride on the track that's had anything to drink.
Right.
okay. Sue, you have any questions?
Yeah, what does JD stand for?
John Day, John Day is the founder of the racing organization. I'm not sure the year of its
Supreme Court.
founding. I'm guessing about 10 or 15 years ago.
So it's not, doesn't have to do with John Jay for the Supreme Court back in 1776 or whatever, right? Okay,
John Jay.
all right.
Tammy, so you had some concern about this. Does this assuage your concern, or are you still?
I think it is, knowing that Rick acknowledges that the other J-Days have not been that great. Because I went on the J-Day website and I looked at, I think it was the last J-Day that they had in September in Massachusetts, and there was 0 social distancing, 0 masks, kids on top of walls.
Agreed.
It looked like it was any other day, not in the middle of a pandemic. So that's why I thought, we need to know that something different is being done, and it's more under Rick's program and not whatever the J-Day,
Tammy, I agree 100%. And there isn't another track in New England until last week, to be honest with you, that even came close to living up to the restrictions that we've put on the riders and the people that are attending the event. Last week, Cape Way Rovers down in Middleborough, Massachusetts, made it a mandatory mask, period. And it was adhered to. Keith was there. My son was there. He was there with his young boy racing. And it was adhered to 100%. Well, 100%. You can't. There are always still going to be those that will fight it. And those are the ones that will be photographed. That's nothing, they're the ones that I'm going to document. And where I can, trace it down to a rider registration number and go back to the organizer and make sure that they're not allowed in my track anymore. And we've done that already. We've sent people home. We've done it because they will not adhere to our rules.
So at what point, Mr. Johnson, are you prepared to call a police officer to restore order or get order? Because they're our agent and they can come to your place if they need to. And what's the tipping point?
When I feel physically harmed, I'll be the first one to call. Other than that, I will self-police it unless it gets to a point that there's more than one individual or it becomes a group of individuals, then I will bring in the police.
Tammy, you okay with that? Sue? Sue, you have any
Go
questions?
ahead, Tammy.
She said she gave it a thumbs up.
I
She
have no,
said,
Sorry.
Jean?
No, I'm not really happy with any public event right now. So I guess I'm not totally convinced because, I've been to the motocross, I know, but then again, it's a whole new ball game and I haven't seen what goes on now. So
If you haven't, if I may, if you haven't been there within the last few weeks or the last month and a half, it has gotten better and better and better every single week. Every week. This past week was just incredible. I was very proud. I mean, I looked around and I saw people walking up to watch the races from the side of the fence wearing masks. And that is slowly progressed over time. The culture has been very difficult to change, but they have been responsive.
So are there any events here planned in Southwick aside from this one?
We have events every week,
When are they?
every weekend.
Okay, when's your next one?
Well, we canceled the one on Saturday because of the weather coming in.
Okay.
And then we have the next one, which will be the last New England Sports Committee race of the year, the weekend after that. But we have run 20 events in the last 20 events in the last 19 weeks.
So October 24th will be your next event.
25th.
25th is a Sunday.
Yep.
And when is this J-Day planned for?
The weekend after.
November 1st.
Okay, thank you.
You're welcome.
So have you, Tammy, have you heard any cases that have been traced back to the motocross that you know of?
Say that again?
Have you had any reports of any cases traced back to the motocross?
No.
Okay, well, there's your answer. Okay. So either we're really lucky or really good. Maybe a bit of both.
You know, I would say we've been both. I think we've been as diligent as we possibly can to prevent any issues. At the same time, things sneak up on you as they have in many other areas, but it's not like these gatherings that are taking place that are just arbitrarily people thrown together with absolutely no protection whatsoever. We have not, that's not what we do. You know, when our workers come to the track, they have to fill out a COVID-19 questionnaire. It's the same questionnaire that I went through to get my test last week in a medical facility. And when they arrive, their temperature is checked by our medic, our on-staff medic, every single time. And it's recorded, every single person that comes in there. So we're diligent in taking care of this and keeping our own people safe and the people of Southwick safe. And we have a lot of residents that come.
Excuse me, Mr. Johnson, I hate to cut you off. Peter, I know you have to leave. You have any questions or comments?
Really, I'm just here for the COVID numbers for the week.
I'll email them to you if you want, Peter.
Okay, that'd be great. Thank you. I'll see you guys next then.
Okay, Mr. Johnson, I'm sorry.
No, that's quite all right. That's quite all right. I understand. Basically, that's it. We feel that we have it in control. We have the rules in place. We've escalated or increased our staff just for this purpose. I personally, because I have a great staff on the track taking care of the riders themselves and the running of the race. After sign up is all over, all I do is run around and make sure things are right in the pits and make sure everybody's doing what they're supposed to do. That's my job. If I don't do it right, you're not going to let me do it.
Anybody have any questions?
You know, maybe Rick, because you and I kind of talked about it or discussed it in email about riders from the non-lower risk states, AKA
Not the high risk, but we're not supposed to call them high risk.
Through pre-registration, and Rhode Island is the one that comes to mind, we're able to identify prior to the event. And we contact each and every one of them one by one. We give them the option of either presenting their negative COVID-19 test, or they can opt out and we send back their money. And that's what we've done ever since Rhode Island came on that list.
Thank you.
Doug, any questions? Concern?
No, I would like to the question I have is how many people can be present for an event of any size? I don't know the answer. That's why I come to listen to these great meetings.
So this is a little bit of a tricky one because this isn't like a basketball court where you're limited to, a set of
25 players or whatnot. Because it's spread out, there's really not a participant number that we can put on it. But the numbers that actually, so as of October 5th on the newest EA guidance, there can be no groups on the motocross track anywhere that are greater than 100. So, while a race is going on, if pit crew, like they can't conglomerate in a group of larger than 100. That's pretty much number-wise what's put on the motocross. And from the pictures that you showed me, Rick, the way that people are spread out, I don't see 100 people.
No. If a class is completely and totally packed, you have 40. You have roughly 15 caution flaggers on the track. You have your head referee. You have our medic, and ambulance crew. Altogether, that doesn't come to 60 people.
Yeah, and the participants, so the racers themselves are not part of that 100.
No, they're not. No, they are.
Like
that's
when you're
part of it.
counting that, that's
If you want to count, if we had a class that had 30 people in it, I would dance naked in the street because we'd finally start making money. But we don't have that many. Normally you have 18 or 20 at the most. Because we're 25% off of normal numbers.
I see where I'm struggling. Rick, I get it. And I know that you guys are doing your thing. It's just kind of, this has always struck me as odd. Like you can't have 100 people at Wally Park for a thing, but we can somehow put 300 at the Moto. I get it because it's a totally different thing. I understand it. I just want to make sure that that it's okay to do what you're proposing to do. I think it's a great way to do it if people can get out and get some air and, you know, do the J-Day thing with their family and have a great event safely. God bless. I think it's a great idea. Just want to make sure that we can, and that's why I came to ask the question because I don't understand the math, and that's why I always defer to Tammy on these things because she knows the rules inside and out.
Yeah, this one is not so much a math number as a social distance and other COVID measures number, the way it's put, because it's it's adult sport. I mean, yes, there are children, but he has to abide by the adult rules, not the youth rules. Right. So it's a lot different.
Yeah.
So I would feel better if there was some official security there that would have a little more power than, hey, please put your mask on or I'm going to take your picture.
Done. I'll take care of it.
Okay. We're good. Okay.
I will have a police detail there from 6 o'clock in the morning until closing.
I'm finished. Okay. Thank you very much. That was easy.
You're welcome.
Gene?
I'm at a loss. I really don't understand this. You've been doing something there every single weekend. Why is this event now being part of this meeting?
Because I wanted to know a little bit more about J-Day after looking at the J-Day website and not being impressed with it. And the J-Day website is not the WIC website. It's completely different. And it was brought up to me.
And that's why I wanted it to be very transparent.
Okay. That explains
it. You guys can know that these are all the things I have been talking to Rick about the whole time because he's here.
Okay.
So,
well, look, first of all, I thank you for allowing me to come to you and bring you up to date on some of the things we're doing and how it's getting better. And we're very proud of the fact that we've had 20 events and we've had no incidents. J-Day has had 8 events, larger than the ones that we've had, with absolutely no incidents. It's generally the same people that come every single week, and they take care of it, and we plan on making sure that they do.
good luck.
Thank you very much.
Tammy, you have any questions, Mr. Johnson?
No, I'm good.
Sue, Gene?
No.
Okay, are you
I'm all
happy
set.
with?
Thank you.
I'm sorry.
Thank you, Mr. Johnson.
Yes, thank you very much, Rick. I
Thank you.
appreciate it.
Yeah, thank you.
Tammy, as always, I will document everything and send it to you and make sure that you have a full report.
Tammy, you satisfied with the what went on now?
Yes,
Guys, your blessing?
satisfied.
Okay, thank you, Mr. Johnson.
Thank you. Have a
Appreciate
great
it.
evening.
Have a nice day. Okay, that went well. Madam Director. wanna give us
Am
your-
I next?
You're next. According to the agenda in front of me.
Okay. This has been more of like a
Research heavy 2 weeks and a small fires putting out kind of heavy 2 weeks. Although speaking of fires, it smells so bad in my neighborhood right now with the Bondies. It's suffocating. I wouldn't even let them leave the door open. Anyway,
Have a thought for the Southwick Fire Department, which is there tonight too.
You got called in
Yes.
also?
Oh, hold on a second.
He's gonna burn until it stops, until it rains.
You want to say hi for a second?
Hello. Who are you?
I gotta. This is Miles.
Hi,
Hi,
Miles.
Miles.
Your face is dirty. I do have to keep.
Hi, Miles.
So you gotta go
Faces
down.
are supposed to be dirty.
I'm getting the monster truck Lego.
Okay, can you close my door?
Okay.
Thank you. Such a polite little knock on the door when he comes in. Okay. So we did, let's see. All new, I had all new soil, I had all my perk tests were actually for all new properties. So I had one at 7 Noble Steed, 8 Noble Steed, and one at 76 Coes Hill. I did final septic inspections at 26 Birchwood, 21 Starrett, 45 Birchwood, and 100 South Loomis. Let's see. So this kind of goes into, no, I'll just go back to this other thing. So this week was the beginning of the annual Mass Health Officers Association conference. But that's usually 3 consecutive days, but they're now doing it 3 Wednesdays in a row, and it's all online, obviously. And it's been kind of nice to learn some things that aren't COVID. There actually was topics not COVID, which, by the way, everybody, if you were worried about the status of STIs in the state of Massachusetts, they're back up to normal and very high. The high is 50-year average. So apparently, while people are wearing masks, they're not wearing other things. My saying. And then, so
Did you
jump
go through that
to
again?
what?
Oh, what did you say? Oh, I got it. I never mind. I got it. Okay.
Am I making Judd blush? I'm
No,
sorry.
it's fine. Okay.
This is my favorite meeting of the week.
Yeah.
Oh,
You
wait.
never know what's going to happen. Health
Well,
director with a mustache
Yeah.
and a banana,
Yeah.
the double entendre, and now we find that people are wearing masks and forgetting other important things that they
Yeah,
should be
well,
wearing at critical junctures.
Actually at the I guess a lot, well, it was actually really fascinating because it was looking like a lot of different types of diseases were looking better for a while, but really it was because people weren't seeking medical help. So that was kind of interesting to know about. Let's see.
Can I interrupt just
You'd
for a
think
second?
with all this hand washing that we'd be going in the right direction, but
You don't have to
I don't
wash
know.
your hands, Doug. Go ahead,
Well,
James.
yeah,
I'm
no.
sorry. James?
No, I'm just
doing it wrong.
noticing we have an art. Is this art on the screen identified?
Oh no.
Arthur? Is that you? You want to unmute him?
For the purpose of our minutes, we need to have whoever art is identify themselves.
Is this our Art Pinnell?
I don't know, but unless they identify themselves, I'm not sure they should be part of the meeting.
Well,
Should not have been part of the meeting.
what
How
do
does
you-
that go, Doug?
it's an open meeting. Anyone's allowed to sit
Yeah.
in. You can also have a sign-in sheet and so on and so forth, but I've been to plenty of meetings where people don't sign in. It's an open meeting. If this was being broadcast on Channel 15, like, some other boards' meetings are, they could watch it from home. He's not being disruptive or whatnot.
So
I
Fine.
don't
the
have a
chair is going to
concern.
let Art listen, but if Art wants to speak, he'll have to identify himself. Okay.
Name and address,
Okay.
right? Exactly, just like anyone
Okay.
else.
Okay, let's move on.
Okay, so we'll move on to COVID. Actually, I was talking with Kate earlier today. She's back to working with university, and she said she was going to try really hard to get here tonight, but I know things have been really hard on her. And right before the meeting started, she received a notice that we had another positive case in town. So for right now,
we are at a total of 85, 85 total for the entire pandemic, with 5 active in isolation and 10 in quarantine. I mean, the quarantine number might change once she's done her full case contact with whoever the newest case.
So if I'm not mistaken, we had 74 at the last meeting. Is that correct?
78.
No, 81.
81. So, okay, so we're still on a purely flat trajectory. Is that correct? So Tammy has left the building.
Sorry
So
about that.
still on a, what you would call a fairly flat trajectory, would you say?
Well, those cases have put us into the yellow category. We completely skipped green, and because we ended up, now we're at 7 additional cases in the last 14 days, it's put us into yellow, which is 1 below red. But if you look at the numbers, like, so I was curious where some of the other towns are. So 6 cases put us in the yellow in South, but 61 cases put Chicopee in the yellow. So it's not completely as you know, transparent as everyone was saying. It's, you know, 5 cases, then 8 cases, then 11. It's they actually are doing some calculation on it.
Now, are those quarantine people goes a part of the school? The school?
Some
cases
yes,
you've heard
and
of?
then some would be part of the other cases we have in town.
So can we get to
Can I
this?
ask a couple questions?
Go ahead, sir.
Jerry, can I ask a couple? Okay.
Sure.
These new cases, ages, how did they get it?
I wish Kate was on the line because she's the one who has, she should be here talking about it. I haven't been on Maven yet this week.
So you don't know.
No.
All right, at the school, student, teacher, housekeeping? Who's the
I
person?
believe they are only allowed to,
Department.
School they're in, not whether or not it's a student or a teacher or staff. I mean, student or staff.
So how many cases did we have total from at the school?
2,
And how many quarantines from that?
3.
So out of the 6 cases, did you say 6 in the last,
so now we're 7.
7?
But like Kate just received this last one right around maybe 5 o'clock, so I don't know anything about that one.
Oh, well.
Okay,
We
there's
also,
there's 7 cases and 3 are from the school.
2 are from the school.
2, okay.
Or quarantined contacts.
The people, okay, the ones at the school, residents of Southwick?
Yes.
Residents
No.
of Southwick?
No, actually, I take that back. One of the cases is not a resident of Southwick. The one in isolation is a resident, one is not a resident.
And no
All right, we have 5 in
hospitalization?
isolation.
No hospitalizations as far as I've told. Kate usually tells me that. Yeah. Also on the radar is cases popped up with Granville, but I spoke with the nurse covering that, and she says even though they reported 2 cases, it's actually 1 in Granville. So since they are part of our school district as well. 0 for Tolland. But their numbers, even if their numbers, that's the thing about this system, even if their numbers went off the chart, Southwick is the one that we would utilize to determine what to do with the schools.
So what happens when we go into red?
So if we go into red for 3 consecutive weeks, we would have to go to remote.
And how close are we to remote? How many cases?
I think that we estimated it could be either 8 or 11. I'm not quite sure.
Is that over a 3-week period or any 1 week or?
That's over a 2-week period, but we would have 3 weeks. if we had 3 weeks of red, we would go remote. But honestly, from from all the meetings, I've already had 3 separate meetings with the school department this week. I think that we would, if we had 3 cases, we probably would do a 2-week remote. Kind of depending on them. You know, if they started showing up more than 1 in each school, it is kind of hard using the metric because they are cases in our community and they could not even have anything to do with the school. But that's, you know, but that would be, we'd have 2 different measures. We'd have the metrics and closing down the school that way. And then there'd be, if we start noticing outbreak within the school community, then we would close from the inside, make that determination.
Janine?
No,
It's
you know, what are you gonna do at this point?
no.
Yeah, it's a tightrope.
But like just the meetings we have together, everybody involved, everybody's really on it and on top of it, from the school nurses, administration, even, you know, the maintenance, they're on it. And I mean, the numbers will go up. I see that happening. It's not, and it won't be in any fault of anybody in the school system. I'll tell you that. They're doing a great job.
How often do you have meetings with the school?
Well, we have
How
a
often do you have meetings?
we have a definitive date of every Thursday morning, but this week we've met already 3 times. Zoom meet, not real meet. Yeah, and we met on Monday on the holiday and
Tuesday and then today. So we're getting used to each other.
I guess I would just like to know, okay, not the school, but the other people that are positive. I would just like to know elderly, young, where they were exposed, things like that, just to know what's going on.
The conversations I get from Kate, a lot of people don't really like to give that information to her. I know she's experiencing a lot of resistance to questioning. So a lot of it is, you know, she has to do the best with the information that they give her and take it with that.
Are the restaurants writing, are they supposed to be writing down who comes in to eat in?
I can't hear you.
Are the restaurants supposed to be taking ledgers of who comes in and phone numbers?
It's not required, but it is suggested.
Unless you require it, someone won't do it. Okay.
A lot of people don't like the idea.
Okay.
But I guess
Joe's
I
got
would
a
want to
mute.
know if I went someplace if all of a sudden an outbreak came out.
Did you check out IBS?
I was going to go today, but I could not make it there. I printed out a bunch of signs and started laminating them, but that'll be on my list for tomorrow. I've got some nice bright signage.
Somebody want to clue me in about IBS?
Oh, there's a complaint just regarding there's lack of signage and enforcement.
Okay.
Mask enforcement, sorry. Yeah. But I found printer ink, so I was like, oh, good, I can print up some signs.
I think Southwick's not the only town that's suffering from COVID fatigue at this point. You know?
For a lot of people, I think that once people start seeing the numbers go up and they start getting affected by it again, that might be the thing that kind of
Snaps it back.
higher, but I agree with you. I think there's a fatigue. If you guys aren't experiencing it, I would love to know your secret.
Okay.
And
Are you, Tammy, is that
I
anything
keep
else?
misplacing my minutes or my notes.
So to be clear, we've had how many cases in the last 2 weeks?
This will be 7.
7 cases in 2 weeks, and we have 5 people in positives and 10 people in isolation.
Yes.
Okay, that includes the 5 plus 5 more.
Say that again.
Is it a total of 15 or is it 5 plus 10?
So in the last 14 days,
14, is that 14? In the last 2 weeks, we've had 7 cases. And right now, 5 of them are considered active and in isolation.
Okay,
And I can't say if we've added any extra quarantine contacts from the last case, but before that, there were 10 people in quarantine.
on top of the 5.
Yes, because those people are in isolation.
Okay. All right, and that's the most that we've had since the pandemic started that we.
Oh, no, we had 10 in 1 week.
Okay,
Yeah, that there was 1 week that was just. But sometimes it looks like there's 10 in 1 week, but
it's when they get tested, right?
isolation like a week ahead of it, so it
The numbers can be
skews
skewed
it.
anyway.
Yeah, there's a lot of, and finding out that just this week, so Kate Brown, Dr. Kate Brown, the epidemiologist, was telling us how the numbers are calculated, and I guess there's 2 sets of people at the same time. Basically, they have to count down and put their finger on the button to calculate it, and they both they do it at the same time, and I guess they kind of take an average of the 2 calculations, because by milliseconds, it can change, I guess, throughout the day. So you might not get the most reflective number. I didn't realize it was down to this, this wire, 2 people in a room saying, okay, I'm going to press it in 3, 2, 1. But they can be, I think that's where the discrepancies kind of lie. Like I said, the nurse for Granville ran the positives on the phone with me. She goes, only 1 pops up, and it was from 2 weeks ago. So the fact that all of a sudden 2 cases pop up, it's not as reflective as what the actual public health nurses on the ground are seeing.
Okay, anything else, Tammy?
Let's see. Every week the state continues to lower the number of lower risk states on the travel order. So now we're down to Connecticut, DC, Maine, New Hampshire, New York, and Vermont. So you travel out of this state to any place other than that, you have to be part of the travel advisory. So I think we might have talked about it last weekend or so. So of the $13,000 that we've received for the local public health COVID grant, we just finished off and emptied out the account completely this week. But we're going to be able to, so Kate's work can be put on a revolving COVID account for the town, which is good. And anything that we need, I was able to attend a webinar for the CARES Act funding. So the money will be available to us. Even though that grant's gone, we'll still be able to fund all the COVID work that Kate does. And if we need any type of PPE or something, there'll be money for that. And that's that. I think we jumped minutes, so, or we jumped the agenda from my report.
No, that's fine. Okay, so
That's that.
the last thing on the agenda was the permitting fees. I was approached by 2 of the select board saying that they were going to reduce the alcohol liquor license fees. Is that correct, Doug?
Sir, yes.
Did they do it, or are you?
We've got our best man, one of our best men on it. He's been charged with reviewing that and making the final call on the number. But yeah, we are going to reduce our fees for 2021 calendar year.
So we were asked to take a look at our fees to see if we wanted to reduce them at this time. So I thought that I had an obligation to bring it to the board and see how the board felt. And I think I'll start with Tammy. Tell us about the numbers that you see, and what was your projection for the fees for next year?
Well, I don't propose to reduce our fees whatsoever. I actually did I looked across many towns in Massachusetts, including many that were of the same population size as ours, and our fees are still very low compared to any of these other towns. I've also spoken to my peers in other health departments, and nobody has asked them to reduce their fees for 2021. My only thing I would say is I was already contemplating asking the board if we could remove the milk and cream fee, because it's a slightly antiquated permit. And by doing that, just about every single person that pulls a food service license with us wouldn't have to pull this additional license. So that would include Moodlicious, because that's milk.
How much is that? That fee is how much? $300?
It's $5.
$5.
So that would be a 5%
There you go, Joe.
increase in your permit right there.
Sue, you have any comments?
No, I make a motion to remove that permit.
I'll second that motion.
All in favor? Sue,
Yes.
Jean,
Yes.
Jerry, yes. Okay, Tammy? When do the letters go out for the renewals?
I would like to have them out on October 31st.
Okay. You guys agree with
I've
that,
also
Sue?
been updating all of the old applications because
They were the standard boilerplate from the state, and state just asks too much information of applicants. Whereas, I guess anybody who knows the food safety process knows that they don't need to ask a lot of the questions. So I've put together already streamlined versions that I think will make it easier for people to fill out. Just to make it easier for the whole permitting process in general.
When you finalize that, Tammy, can you email us a copy?
I can do all of them because we'll
Okay.
have more than one permit.
Okay.
Okay, Sue, you
Just, I
disagree?
just
with-
like to look at it, that's all.
Okay,
Okay.
Sue, you disagree with Tammy's assessment about our fees?
I agree. We just cut off $5.
Jean?
Yeah, I'm fine.
Okay, that'll end that. Doug? Okay?
To be clear, I just want to make sure I wasn't talking across the board. We were looking specifically at restaurants and retail businesses that have been impacted. So obviously we weren't looking for you to go back at septic fees or any of the other permitting fees. This was only around food service and restaurant service and retail.
Okay,
But appreciate the gesture. I think it's, 5% is 5%. Whatever you guys can kick in, we'd appreciate it.
Joe, anything you want to add?
No, thank you. It's just our ACE select board member that's apparently not on tonight suggested just the liquor side of things, and I didn't think it was fair. We should look at everything. I appreciate you guys taking a look.
So for ha-has, I wrote a letter to the Board of Registration and Dentistry and asked them if they were going to reduce the license fees for the dentist, and I got an answer the next day from the executive director saying, well, they're not responsible. It comes from the executive office of fees and wherever, finance. And she did not know of any move to reduce any license fees for the state. So I just wanted to, just for my own sake, just to see what the dental board was doing. And the answer is nothing. So,
Board of Sanitarians isn't either. And not, They're not waiving the CEUs for the year either. Oh well.
Okay, so that'll end it.
Neither for me at the hospital.
Okay. So I don't suppose that the CDLs or the commercial driver's license fees are going down either, Gene, is that right?
Yeah. No, nor is the fees for the DOT physical or the fees that we have to do for self-certification or the numerous other fees that we have to pay to have a CDL bus license.
I think it's a great gesture, Doug and Joe, but I don't know if you start where you stop and who you stop with.
That's why we asked the question, right? And we do appreciate everybody taking a look, and obviously people spent significant time to look into it as far as going to the dental board and to other towns and cities to see what they're thinking. And we got our feedback. And by the way, taking a look at that, the milk, I remember somebody actually mentioned that to me, that fee a bunch of years ago, and go, that's crazy in this day and age. It's just a legacy thing. But so great idea. Now's the time. Get rid of it.
Actually, it'll probably save us a little money and extra paperwork too.
It probably will.
Okay. Anybody else want to discuss the fees at this time?
No.
Okay, anybody have any other, Doug? Anything you want to ask, say, comment? Before we adjourn, before I get a motion?
Happy
Anything on your
Halloween.
mind?
Oh,
I
yes.
don't know. I was going to make a motion to
Hold on.
adjourn.
No, wait a
No.
second.
It's
Joe, anything you want to talk about?
No.
Jessica?
No,
Sue, anything you would like to say?
The trunk or treat is going to take place or already took place?
It's on Halloween at the high school. I think it's 3 till 6.
Okay.
Okay,
Drive
so,
through.
all right, so before we adjourn, let me bring up the Halloween fiasco. So I assume there's going to be no town policy, and I'm going to leave it up to each individual parent to try and keep their children and themselves safe during this time. Is that correct? But there are no group activities that you know of that are being sponsored, and if they are, they'll be discouraged. Is that right? That as Halloween approaches, is that the select board's view? Doug?
I spoke on this last meeting. I appreciate, again, Tammy has put on the website some general guidance, and it's kind of a be smart, don't go out with, 50 kids, in a group door to door. Maintain your distancing. People are going to have probably some interesting candy delivery mechanisms set up at their homes. You got the trunk or treat at the high school with a distance drive-through Halloween for those that want to do it that way. And I think that's the best way to do it. And without, the town doesn't need to get involved. I think we can just give some good guidance and say, be smart about this, people.
We're gonna use the bulletin board next to the bank?
Oh yeah, and thanks to Jessica for bringing that up, because Dennis Clark was able to put up like safe Halloween information on that bulletin board.
Okay,
Fantastic.
good enough.
Thank you, Jessica.
All
you
right.
are welcome.
Jessica, you have anything for us?
No, I have nothing.
Sue?
I'm all set.
Gene?
No, I'm set.
Happy birthday.
Thank
Okay,
you.
I take a motion to adjourn. Next meeting is November, is it 5th?
I remake the motion that I made 5 minutes ago about adjourning, but just
Okay.
change the time just to now, okay?
The chair will
You got it.
accept that motion at
Second,
this
and thank
time.
you, everybody.
I need
My
a second.
favorite meeting of the week.
Okay, all in favor? Sue,
Yes.
Gene,
Yes.
Jerry,